the hard part. You've lost a significant amount of weight, and now you might be thinking about surgery, even surgery abroad. I'm Zeinab. I'm the pharmacist from PillSorted, and I'll explain what are the risks involved in this serious medical decision and what are the extra risks that you need to be mindful when you want to do this abroad. There's a couple of common surgeries. One of them is called abdominoplasty or tummy tuck, where you have a cut from hip to hip close to your underwear line, your pants line. They pull out the lipids, they stitch the muscles together, and then they pull the excess skin and cut it, and then they make a fake belly button. Then there is the breast enhancements and reductions. You'd have 2 cuts on the sides of your breast, and there will be, if you've decided on having implants, you'll have the implants on. Again, the excess skin is cut off. There might be nipples made again. And the third one that happens a lot is the underarm surgery, where people call it the bingo wings. What they do is there'll be a big cut in the inner part of the arm, where again the lipids and the excess skin are cut off, and it's called the brachioplasty. All of these can have different extents. It really depends on person to person. Now, why is abroad becoming much more appealing? There's 2 things mostly when people talk about it. One of them is cost. It's more cost effective. They don't have to wait for too long. The other thing is actually a sense of treating themselves. So they feel that this is something nice as a prize, and going to somewhere nice with it, like medical tourism. Let me go into some specific risks that I see when this surgery is happening. First of all, the surgery itself is a major surgery. Most of the times you need to go under general anesthetic, so dealing with that recovery from the surgery is an important step by itself. But then there's 5 specific risks that I want to explain a little bit more. The first one, by far the most important one, is infection. So infection can happen for any surgery, and it can cause a lot of complications. It needs a lot more time to recover and heal. What the infection means is you'll get a lot of redness and swelling in the surgery area. It might cause a fever. However, because you're going to be on pain relief, that fever might not show until it's really, really late. You'll have a smelly discharge from the infection. Okay, this can happen anywhere between day 1 to day 7 of a surgery, but infection is really important. You do need to keep an eye out for all of the scar areas. Because it's a deep wound, it can be further in, so it's not just superficial. You need to make sure that you've got enough infection protection, be it in the dressing, be it in antibiotics, be it in right before surgery and after surgery. You've got enough protection. The other specific one that I want to talk about is the drains. So all of these surgeries will involve you having drains or tubes for at least a couple of days or weeks. Okay, now what is the important thing that the drains and tubes do? The natural part of your body is when the skin and the muscles have been separated, the body starts filling it up with fluid. That fluid is what's it called, serum. So that fluid can build up based on how your body reacts and how much it feels that it's been an inflammation is happening. So these drains have a gentle negative pressure that will pull this liquid out, and that gives a chance to the muscle and the skin to actually stick back to each other. This takes time. It really takes a lot of time. You need to be mindful of those drains. Now, things that you need to be careful is you don't want the drains to come out too fast. It really is different person to person. The discharge needs to get measured, and it needs to go into double digits for at least 2-3 days. So really reduced amount of fluid is the important outcome of the drains coming out or not. The other thing is the drain discharge shows some level of how the surgery is healing. For example, at the beginning you might have some pink and your blood in it, then it will go clear yellowish until then it stops. But if that discharge goes into white or cloudy things in it, that can be a sign of infection. The drain itself can get pulled, and that causes a lot of discomfort, and it can cause bleeding as well. So those are the things that you need to be mindful about the drain. So don't insist on them to come out too fast. The third one that I want to talk about is actually blood clots. So there's always a risk of blood clots after any surgery. The reasons are you're moving much less, you're going to have more inflammatory markers running around in your body, and the blood vessels have been damaged. all of these can cause higher risk of blood clots. The important things that you need to be mindful about blood clots: there will be medications that need to be prescribed to you for the surgery to support and prevent blood clots from happening. There will also be compression clothes and products. So there will be an abdomen compression for the breasts as well, that you need to wear them for a good couple of weeks. It's not just wear it for 2 weeks and that's it. You do need to wear them for a good couple of weeks because your body still needs to heal. The other one that I want to talk about is wound healing, but I'm not going to discuss it too much here because I am going to discuss it in a further video with proper rundown of all the different dressings. But just a couple of important things about wound healing: it takes time. So you might have numbness in the scar area for a good couple of months. Your internal healing will take months. The scar itself getting out of the initial inflammation will take a good couple of weeks at least. Things that you really need to be mindful of is actually really good nutrition and high protein. Your body will need more calories to recover from this wound healing and surgery. That is a natural part of your body. It's creating a lot of healing things in your body, so it needs extra calories. Don't worry if you have like a appetite surge after surgery, but make sure that you get the right nutrition, especially high protein. The last one that I want to talk about is pain management and your limited mobility. So when you have abdominoplasty, so almost 2-3 days you need to sleep upright. For breast surgery is the same, so you need to sleep in 45 degrees with protective bras on for day and night. With your arm brachioplasty as well, you will not be able to lift your arms up by itself for a couple of weeks, let alone pick anything heavy. So heavy lifting is out of the question for any of these for at least 4 to 6 weeks. So if you've got little children, you really need help for those first 2 to 4 weeks at least. You won't be able to get back and sit in on a desk job for at least another 4 to 6 weeks. If it's a physical job, even more than that. The same for exercises. Please don't start heavy lifting exercises or even gym work at least 8 to 12 weeks after these surgeries. Again, I'm giving ranges, but the more time you give to heal and get through this recovery episode, the better long-term outcome you have for your health. When you're traveling abroad, there's a good couple of important things that you need to be mindful of. One is your travel insurance. On the uk.gov site, there are very good information about traveling abroad or having medical emergencies. There's also really helpful advice on the NHS website and on the British Association of Plastic and Aesthetic Surgeons. Check it out. It's got all the details about how you can check credentials. It's got all the details about what you need to know when you are traveling abroad for surgery. So they're really good websites. Educate yourself about where you're looking at. When you're looking into a website, go for the ones that give you realistic support. So if they try to make it sound too easy, it should be a red flag for you, okay? In a way, all of these risks become a lot more pronounced when you're traveling abroad for these surgeries, okay? So for the infections part, if you're too eager to get onto the flight and come back home, but there's swelling and there's niggling and there's pain, you need to be mindful about it. If it means that you need to delay it a little bit more, make sure that you've got antibiotics with you, make sure that you do those things, okay? The same about your drain. So make sure that you've got the right wound management in place. I suggest definitely make sure that you get the drains out before you travel back home, so you've got that risky part out of the way. The other thing is for the blood clots. You have a higher risk when you're going on a flight. The oxygen level is less. If it's long hauls that you're going to be sitting for a good couple of hours, so like over 6 hours, that significantly increases the risk of deep vein thrombosis, though, which is a lot of swelling and a blood clot in your veins. So again, make sure that you do walking around, make sure that you protect yourself, make sure that you've got the compression products on. For the wound healing and pain management as well, don't carry anything heavy, okay? Be kind and gentle to yourself. It will take time to heal. That's something that I see a lot of people really be rushing for. Oh, the doctor said I'm gonna be fine within 3 weeks. Well, it's really different person to person, and being fine after 3 weeks has got different meanings. You will not be able to go back up and running and be yourself again once you've had a major surgery. So please be patient with yourself. And with the pain and mobility as well, make sure you've got people to help you through that first couple of weeks, okay? So you won't, it will be difficult to get back on track. Even getting up out of the bed will be much more of a challenge. Now, how does your weight and your GLP treatment come into play here? A couple of important things. Weight gain is chronic and it is relapsing. So it's really important to be ready to see a little bit of change happening in your body. This is the natural part of this condition. Weight gain is relapsing. But what you want to do is you want to make sure that you get back in control of your weight and be able to put in place those weight management things. The other thing about GLPs, so if you've lost significant amount of weight, what the surgeons usually want to see is that you've been maintaining a weight for a good couple of months, and you should be on that minimum effective dose of the GLPs now. So you found the right balance to keep that weight steady before you start thinking about surgery, okay? Now, about the GLP injections, it's really important that at least you come off the GLP injections a week before the surgery, because it does slow down your digestion. It can bring up the risk of delayed gastric emptying, which is important for the surgery part, okay? But if you can even extend it for up to 4 weeks before surgery, it's perfectly fine, okay? A lot of questions come, when do I start back on the GLP injections? It is very different person by person, but at least 2 weeks. The reason being is you want to give your body enough time to recover and get enough nutrition to be able to heal, okay? It's not a bad idea to start on a lower dose if you've been maintaining on a higher doses. Start on a lower dose, let your body adapt back onto the medication. But again, if you need longer breaks from the GLP after that, it's perfectly fine. We want to get through this episode first and then get back onto the weight management. As a recap, if you're considering surgery after your weight loss, just consider it as a important, serious surgery. Make sure that you've got enough information about it. If you've got any questions, we're here to support you find the right advice. This video is part of our travel health series. Feel free to subscribe to our channel and visit our website for that clinician-led health advice. Thank you.